What is infertility? As of 2024, the World Health Organization (WHO) describes infertility to be a disease of the male or female reproductive system defined by the failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. Infertility may occur due to male, female, or unexplained factors. Some causes of infertility are preventable. Infertility due to PCOS. Polycystic ovary syndrome (PCOS) is one of the most common hormonal disorders affecting women of reproductive age. It typically begins during adolescence, although symptoms can vary in severity and may change over time. PCOS is characterized by hormonal imbalance, irregular menstrual cycle, elevated levels of androgens, male hormones, and the presence of multiple cysts in the ovaries. One of the most significant complications associated with PCOS is infertility. The condition often disrupts the normal process of ovulation, the monthly release of an egg from the ovaries, leading to irregular or absent periods. Without regular ovulation, it becomes more difficult for women to conceive. As a result, many women are first diagnosed with PCOS when they seek medical help for fertility issues. Understanding the link between PCOS and infertility is crucial for early diagnosis, effective treatment, and improved reproductive outcomes. Infertility rate among Malaysian women with PCOS. In 2012, a Malaysian study found that 82.8% of women diagnosed with PCOS also experienced infertility, highlighting the strong association between PCOS and reproductive issues even more than a decade ago. Between 2018 and 2019, research by the National Population and Family Development Board (NPFDB) showed that 47% of infertile women in Malaysia were diagnosed with PCOS, confirming the condition as a major factor in infertility cases. In 2022, a study aimed at developing a Malay version of the PCOS questionnaire reported that 79% of Malaysian women with PCOS had fertility problem, reinforcing the ongoing impact of PCOS on women's reproductive health.
There are several treatments for PCOS, but in this video, we would like to highlight about gonadotropin therapy. Gonadotropin therapy is a second-line fertility treatment for women with polycystic ovary syndrome (PCOS) who have not achieved ovulation or pregnancy with the first-line oral medication like clomiphene citrate or letrozole. This therapy involves administering injectable hormone to stimulate ovulation. What is gonadotropin? Gonadotropins are hormones that play a crucial role in the reproductive system. First, follicle-stimulating hormone that stimulate the growth of ovarian follicles. Second, luteinizing hormone that triggers ovulation and the development of corpus luteum. Third, human chorionic gonadotropin mimics the LH surge to induce final maturation and release the egg. These hormones are administered via subcutaneous or intramolecular injection to induce ovulation in women with PCOS. Step 1. Baseline assessment. Before initiating treatment, a comprehensive evaluation is conducted, including first, transvaginal ultrasound. It is used to assess the ovaries and ensure the absence of cysts. Second, hormonal blood test, which is used to determine baseline level of estrogen and other relevant hormones. 2. Initiation of gonadotropin injection. Starting on day 2 or 3 of the menstrual cycle, daily injection of FSH and sometimes LH are administered. The initial dose is typically low to minimize the risk of ovarian hyperstimulation syndrome. Next, step 3, which is monitoring. Regular monitoring is essential to track the body's response. Ultrasound examination is used to monitor follicular development, while blood test is used to measure estrogen levels. Step 4, ovulation trigger. Once a dominant follicle reaches an appropriate size, typically 17 to 20 mm, an injection of HCG is administered to trigger ovulation. Ovulation usually occurs 36 to 40 hours after the HCG injection. Step 5. Timed intercourse or assisted reproductive technique. Following the HCG injections, couples are advised to have timed intercourse. Alternatively, intrauterine insemination (IUI) may be performed performed to increase the chance of conception. Last step, luteal phase support. After ovulation, progesterone supplements may be prescribed to support the uterine lining and facilitate implantation.
Let's take a look at the Quranic verses related to treatment taken for PCOS. Surah Ash-Shura, verses 49 until 50. A'udzu billahi minasyaitonir rajim. Lillahi mulku samawati wal ard, yakhluqu ma yasha, yahabu liman yasha'u inathan wa yahabu liman yasha'u dhukur. أو يزوجهم ذكرانا وإناثا ويجعل من يشاء عقيما إنه عليم قدير صدق الله العظيم. To Allah belongs the dominion of the heavens and the earth. He creates what He wills, He gives to whom He wills female children, and He gives to whom He wills males. Or He makes them both, males and females, and He renders whom He wills barren. Indeed, He is knowing and competent. For the explanation, these verses highlight that the ability to conceive and bear children is ultimately in the hands of Allah. He alone decides who is blessed with children, male, female, both, or not at all. However, the verses also imply Allah's power and knowledge, which includes His permission for humans to seek solution within lawful means when facing challenges like infertility. For the explanation, these verses highlight that the ability to conceive and bear children is ultimately in the hands of Allah. He alone decides who is blessed with children, male, female, both, or none at all. However, the verses also imply Allah's power and knowledge, which includes His permission for humans to seek solutions within lawful means when facing challenges like infertility. In the case of PCOS, which causes hormonal imbalance and ovulation problems, gonadotropin treatment is a medically recognized method to stimulate the ovaries to produce eggs, thereby increasing the chances of pregnancy. From the Islamic perspective, seeking medical treatment is permissible and even encouraged when it aims to restore natural function. As long as the treatment involves only the husband and wife, no third-party donor, gonadotropin therapy is halal. For the explanation, these verses highlight that the ability to conceive and bear children is ultimately in the hands of Allah. He alone decides who is blessed with children, male, female, both, or none at all. However, the verses also imply Allah's power and knowledge, which includes His permission for humans to seek solutions within lawful means when facing challenges like infertility. In the case of PCOS, which causes hormonal imbalance and ovulation problems, gonadotropin treatment is a medically recognized method to stimulate the ovaries to produce eggs, thereby increasing the chances of pregnancy. From the Islamic perspective, seeking medical treatment is permissible and even encouraged when it aims to restore natural function. As long as the treatment involves only the husband and wife, no third-party donor, gonadotropin therapy is halal. This aligns with the Islamic principle of tawakkul, trust in Allah, while also making use of the means asbab provided by Him.
The conclusion is infertility caused by polycystic ovary syndrome PCOS remains a significant challenge for many women of reproductive age, as it affects hormonal balance and ovulation. Women with PCOS often do not ovulate regularly, making it difficult to release a mature egg each month. First-line treatments such as life-changing weight management and medication. However, some women with PCOS do not respond to these therapies or continue to face difficulty conceiving even after ovulation is restored. When other treatments fail, in vitro fertilization (IVF) is often the next step. IVF helps by bypassing the natural ovulation process. Eggs are retrieved directly from the ovaries after stimulation with fertility hormones. Fertilization takes place in the lab and the resulting embryo is transferred into the uterus. IVF increases the chance of conception, especially for women with PCOS who have long-standing or complex infertility. PCOS can make it difficult for many women to conceive naturally, but it does not mean pregnancy is impossible. While lifestyle change and medication work for many, IVF is a powerful and effective option for those who do not respond to initial treatments. With the right medical care and support, women with PCOS can still achieve their dream of becoming mothers. From an Islamic perspective, Surah Ash-Shura 49-50 remind us that the power to grant children lies ultimately with Allah, who gives daughter to whom He wills, sons to whom He wills, both to some and make other barren. This verse emphasizes that every effort is an act of faith and trust in Allah's wisdom and decree. Thus, seeking treatment is a form of striving, but the outcome remains in the hand of the Almighty.